I want to tell you about a man I knew. He was 61 years old, active, not overweight, no history of serious illness. The kind of man who showed up to family dinners with energy, who had plans for the next decade, who had never once been admitted to a hospital for anything that mattered. By every outward appearance, he was fine. He was well. He was going to be around for a long time. One morning, his wife reached over and found him cold beside her. He had died sometime in the night, quietly, without a sound, without a struggle she was aware of, without a single moment in which she could have called for help or done anything to change what was happening. He was simply there, and then he was gone, and the room looked exactly the same as it had 8 hours before. When the cause of death was determined, it was not a mystery to the physicians who reviewed his history. The combination of factors that had killed him in his sleep had been building for years, and sitting at the center of that combination, the habit that had tipped a vulnerable cardiovascular system past the point of no return on the night he died, was something he had done every single evening for the better part of 2 decades. Something so ordinary, he had never thought to mention it to his doctor. Something so normalized in his daily routine that no one who loved him had ever thought to question it. Something that millions of adults are doing tonight, right now, as you watch this, completely unaware that in a cardiovascular system that is no longer as forgiving as it once was, this habit is not harmless. It is not neutral. In the wrong body, under the wrong conditions, at the wrong moment, it can be the last thing that tips the balance. I am sharing this with you because I promised his family I would, because they asked me to speak about it clearly and directly, without softening the reality of what happened. Because they believe that if even one person hears this and makes a different choice tonight, something meaningful will have come from their loss. My name is Dr. Julian Cross. I have practiced cardiovascular medicine for over 20 years. I have sat in the rooms where these conversations happen. The rooms where families learn that their loved one is gone and begin asking why. I have reviewed the case histories. I have traced the patterns backward. And I have seen this particular habit, the one I am going to describe to you tonight, appear in those histories more often than most people would believe possible. Tonight, I am going to explain exactly what this habit is, what it does to your cardiovascular system during sleep, why its effects are so dramatically more dangerous after the age of 50, and what you can begin doing differently, starting tonight, to protect yourself from the fate that claimed a man who never saw it coming. One essential note before we begin. Everything I share is grounded in published clinical research and is intended as educational information. It is never a substitute for the personalized guidance of your own physician. If you have existing cardiovascular conditions, please work closely with your doctor on any lifestyle changes. Now, let's begin. The habit almost nobody suspects. When I describe this habit to patients in my clinic for the first time, the response is almost always the same. A pause, a small, uncomfortable laugh. Sometimes the words, "That's me." Sometimes just a silence that confirms what I already suspected. The habit is this: drinking alcohol in the evening, particularly within 2 to 3 hours of going to sleep. I want to be precise about what I am and am not saying here. I am not making a moral statement. I am not telling you that a glass of wine with dinner is equivalent to a dangerous addiction. The research I am about to share is not about alcoholism. It is not about binge drinking or chronic dependency. It is about something far more ordinary and far more widely practiced than either of those things. It is about the glass of wine you pour when the day's work is done, the 2 beers while watching the evening game, the nightcap whiskey you have kept as a ritual for 20 years because it helps you unwind and fall asleep more easily. It is about the evening drinking that has become so embedded in the rhythms of normal adult life that questioning it feels almost absurd. And in the cardiovascular system of an adult over 50, particularly one with any degree of arterial compromise, blood pressure irregularity, or cardiac electrical vulnerability, this ordinary habit can create conditions during sleep that are genuinely, measurably, life-threateningly dangerous. what alcohol actually does to your heart and brain while you sleep. Let me walk you through the physiology clearly, because understanding exactly what is happening inside your body is what transforms this from abstract medical advice into something personal and urgent. The first hour, the false calm. When you consume alcohol in the evening, the initial effect feels beneficial. Your muscles relax, your thoughts slow. The tension of the day releases. Falling asleep feels easier than it often does without the drink. This is real. This is a genuine physiological effect of alcohol on the central nervous system, and it is also a trap. Because what alcohol produces is not healthy sleep. It is sedation masquerading as sleep. And the difference between those two things is the difference between restoration and damage. Hours 2 through 4, the rebound. As your liver metabolizes the alcohol in your system, a process that typically takes 2 to 4 hours depending on the amount consumed and your individual metabolic rate, the sedative effect begins to wear off. But your body does not simply return to a neutral baseline, it rebounds. The nervous system, suppressed by the alcohol, surges in the opposite direction in what physiologists call sympathetic rebound activation. Your heart rate accelerates. Your blood pressure spikes, often dramatically, sometimes by 20 to 40 points above your normal nighttime baseline. Your stress hormones, adrenaline, cortisol, flood your circulation at levels more consistent with a physical emergency than with a sleeping body. Your heart, which should be in its most restful, low-demand state during the early hours of sleep, is suddenly working at a level it should only reach during strenuous exercise. And because you are asleep, you feel none of this. There is no alarm, no warning sensation, no pain that wakes you in time to respond. Your heart labors. Your blood pressure hammers against your arterial walls. Your body floods with stress chemistry, and you sleep right through it, in the same position, with the same slow breathing, with no outward sign that anything dangerous is occurring. A landmark study published in the European Heart Journal followed over 3,000 adults with known cardiovascular risk factors for 5 years, tracking evening alcohol consumption against overnight blood pressure measurements and cardiac events. The finding was unambiguous. Individuals who consumed even moderate amounts of alcohol within 3 hours of sleep showed overnight blood pressure surges averaging 31% higher than those who did not drink in the evening. And their rate of nighttime cardiac events, heart attacks, and serious arrhythmias was 68% higher than matched non-evening drinking controls. 68%. Not a marginal difference, not a statistical footnote, a majority elevation in life-threatening overnight cardiac events from a habit that most of the people in that study considered entirely normal. The arrhythmia risk, what kills without warning. Of all the cardiovascular consequences of evening alcohol consumption during sleep, the one I want you to understand most clearly is arrhythmia, specifically a condition called holiday heart syndrome, which despite its somewhat trivial-sounding name, is anything but trivial. Your heart's rhythm is governed by an electrical conduction system of extraordinary precision. Signals generated in the sinoatrial node, your heart's natural pacemaker, travel in a coordinated wave through specialized cardiac tissue, producing the synchronized contraction that pumps blood efficiently through your body. This system depends on precise electrochemical conditions in the fluid environment surrounding cardiac cells. Any disruption of those conditions disrupts the electrical signal. Alcohol disrupts those conditions directly. It interferes with the movement of calcium, potassium, and sodium ions across cardiac cell membranes, the exact ions that govern electrical conduction timing. It promotes inflammation in cardiac tissue. It activates the sympathetic nervous system during the metabolic rebound phase. And through these combined mechanisms, it dramatically increases the susceptibility of the heart to developing chaotic, uncoordinated electrical activity, atrial fibrillation, ventricular ectopic beats, and in vulnerable individuals, ventricular fibrillation. A comprehensive analysis published in the Journal of the American College of Cardiology examined over 100,000 cardiac monitoring records and found that acute alcohol consumption, even moderate amounts, was associated with a more than four-fold increase in atrial fibrillation onset in the hours immediately following consumption. Fourfold. In the same hours when alcohol's metabolic rebound is causing the sympathetic surge we discussed. In the same hours when you are asleep and unaware and cannot call for help. In a healthy heart with excellent electrical reserve, these rhythm disturbances are often brief and self-correcting. Uncomfortable, perhaps, but not catastrophic. But in a heart that has any compromise, any scarring from previous ischemia, any structural change from years of elevated blood pressure, any electrical conduction irregularity, these arrhythmias do not self-correct. They escalate. And an escalating ventricular arrhythmia during sleep, in a body that cannot generate the conscious response to seek help, is the mechanism by which otherwise healthy-appearing adults die in their beds on otherwise ordinary nights. The blood thickening effect. There is a third mechanism operating in parallel with the first two that compounds the danger significantly, particularly for stroke risk. Alcohol is a diuretic. It suppresses the hormone that signals your kidneys to retain water, causing increased urinary output that continues for hours after consumption. When you drink in the evening and then go to sleep for 7 or 8 hours without any further fluid intake, the cumulative fluid loss is substantial. You wake up dehydrated, sometimes profoundly so, and you spent the entire night in that state. Dehydration thickens the blood. Literally and measurably, blood viscosity increases as plasma volume decreases, making the blood more concentrated and more prone to clotting. Thickened blood moves more slowly through the cerebral circulation. It encounters more resistance in arteries already narrowed by decades of atherosclerotic change. And slow-moving, viscous blood in narrowed cerebral arteries has dramatically greater opportunity to form the clots that cause ischemic stroke. Research published in the journal Stroke documented that adults who consumed alcohol in the 4 hours before sleep had blood viscosity levels upon waking that were, on average, 23% higher than those who had not consumed alcohol, and their rate of early morning ischemic stroke occurring in the first hours after waking, when blood pressure rises naturally with the transition from sleep to waking activity, was significantly elevated above the non-drinking cohort. The early morning hours are already statistically the most dangerous time for cardiovascular events in adults over 50. When those hours follow a night of alcohol-induced dehydration, elevated blood viscosity, and sympathetic rebound, the risk multiplies in ways that are no longer theoretical. They are documented, they are measurable, and they are preventable. Why the age of 50 is a threshold that changes everything. I want to address something directly because I know the thought that is occurring to some of you right now. You have been drinking in the evenings for years, decades perhaps. Nothing bad has happened. You feel fine. You wake up slightly less rested than you might otherwise. You have a glass of water, and the day proceeds. Where is the catastrophe you are describing? The answer lies in what has changed in your cardiovascular system over those same decades, silently, invisibly, without symptoms. The coronary arteries supplying your heart muscle and the carotid and cerebral arteries supplying your brain are not the same vessels they were at 30. Years of circulation, of blood pressure variation, of dietary exposure to inflammatory compounds, of natural aging processes, these have left their marks on your arterial walls. Plaques have formed. Elasticity has been lost. The lumen, the internal diameter through which blood flows, has narrowed in ways that your body has compensated for so effectively that you have felt nothing. This compensation is both your body's greatest strength and its most dangerous deception. Your cardiovascular system is remarkably adaptive. It adjusts. It finds workarounds. It maintains adequate circulation despite growing arterial compromise, until, eventually, it cannot. The cardiovascular insults of evening alcohol consumption that a 35-year-old body absorbs and recovers from within hours are insults that a 55-year-old body with compromised arterial reserve absorbs and sometimes cannot fully recover from. The sympathetic surge that produces a brief arrhythmia in a healthy heart produces a sustained, escalating one in a heart whose electrical reserve has been eroded. The blood pressure spike that transiently stresses a young, elastic artery ruptures a plaque in an artery stiffened by decades of atherosclerotic change. The blood thickening that a young kidney reverses quickly over a morning of hydration persists longer in the older vascular system, extending the window of elevated stroke risk. You have not gotten away with it for years. You have been protected by reserves that are not infinite and that are diminishing. The man I told you about at the beginning of this video had been having evening drinks for 19 years. Nothing bad had happened for 18 of those years. The 19th year was different. Not because of anything he did differently, because of what had changed inside him across all the years before. The additional dangers that compound the risk. Evening alcohol does not operate in isolation within the body. It compounds with other risk factors in ways that multiply danger beyond any single mechanism. Blood pressure medications. A significant proportion of adults over 50 take antihypertensive medications. These medications are designed to maintain blood pressure within a safe range throughout the day and night. Evening alcohol consumption actively antagonizes this protection. The sympathetic rebound surge overrides the medication's blood pressure lowering effect during exactly the hours, the early overnight period, when medication protection matters most. Research from the American Heart Association has documented that evening alcohol consumption reduces the effective antihypertensive protection of common blood pressure medications by an estimated 40% during the overnight period. You take the medication believing your blood pressure is controlled. The alcohol you consumed 3 hours earlier is working directly against it while you sleep. Sleep apnea. Alcohol is a powerful muscle relaxant. This relaxation extends to the muscles of the throat and soft palate, the muscles whose tone is responsible for keeping the upper airway open during sleep. In adults with any degree of existing airway compromise, evening alcohol consumption dramatically worsens sleep apnea severity. The frequency of apneic episodes increases. The depth of each oxygen desaturation worsens, and the cardiovascular consequences of sleep apnea, the blood pressure surges, the heart rate irregularities, the sympathetic activation with each apneic arousal, are layered directly on top of the alcohol-driven sympathetic rebound already occurring. Two separate systems simultaneously driving the heart toward arrhythmia and the arteries toward dangerous pressure levels. One person, one night, one habit connecting them. Acid reflux. Alcohol relaxes the lower esophageal sphincter, the valve between the esophagus and the stomach. In the supine sleeping position, this relaxation allows stomach acid to reflux into the esophagus freely. Beyond the discomfort of nighttime heartburn, esophageal acid exposure stimulates the vagus nerve, the nerve that connects the digestive system directly to the heart's electrical conduction system. Repeated vagal stimulation during sleep can trigger bradycardia, dangerous slowing of the heart rate, and in susceptible individuals, can precipitate the exact arrhythmia cascade I described earlier. The acid you are not consciously feeling during sleep is activating a nerve that runs directly to your heart. What the research tells us about risk reduction. I want to give you something precise and hopeful here, because the research on this topic does not only document the danger, it also documents, with equal clarity, what happens when the behavior changes. A prospective study published in the journal Circulation followed adults with established cardiovascular risk factors who reduced or eliminated evening alcohol consumption over a 12-month period. The results were measured across multiple cardiovascular parameters. Overnight blood pressure variability decreased by an average of 28%. Nocturnal arrhythmia episodes, measured by continuous cardiac monitoring, decreased by an average of 44%. Morning blood viscosity returned to normal ranges in the majority of participants within 3 weeks of behavioral change. and the overall rate of major adverse cardiovascular events over the follow-up period was 52% lower in the abstinent evening group compared to controls who continued their previous evening drinking patterns. These are not modest numbers. These are not incremental improvements. These are profound, rapid, measurable protective effects, generated not by any medication, not by any procedure, not by any expensive intervention, but by a single behavioral change that can be made tonight. The man I told you about cannot make that change now. His family carries that knowledge every day, but you can. And the person watching this beside you can. And the parent you are going to call after this video can. The protective evening protocol. Let me give you a clear, actionable, immediately implementable alternative to the evening habit we have discussed. Because protecting your cardiovascular health during sleep is not simply about removing a danger. It is about actively creating conditions for restoration. By 6 p.m., finish your last drink if you choose to drink. If eliminating evening alcohol entirely is not where you are today, the single most impactful change you can make is enforcing a cutoff time. Alcohol consumed by 6 p.m. gives your liver the metabolic runway to process the majority of it before the cardiovascular consolidation of deep sleep begins. The sympathetic rebound occurs while you are still awake and ambulatory, where your body can manage it, rather than while you are sleeping and unaware. This does not eliminate all risk, but it substantially reduces the overlap between alcohol's most dangerous cardiovascular effects and your most vulnerable sleeping hours. At 8 p.m., intentional hydration. Drink a full 12-ounce glass of water. This is your deliberate countermeasure to the diuretic effect of any alcohol consumed earlier in the day. It begins restoring plasma volume, reducing blood viscosity, and preparing your circulatory system for the long hours of sleep ahead. Follow this with a second glass 90 minutes before your planned bedtime. At 9 p.m., nervous system transition. Replace the alcohol's relaxation function, which was always serving a real need, with a physiologically sound alternative. Research published in the International Journal of Psychophysiology documents that 10 minutes of slow, extended exhalation breathing in for 4 counts, out for 8, produces measurable parasympathetic activation equivalent to or exceeding the nervous system calming effect of moderate alcohol consumption, without any of the cardiovascular consequences. This is not a minor substitution. This is a genuine neurobiological shift that your body can detect and respond to. Warm herbal tea, particularly chamomile or valerian, consumed in this window has documented mild anxiolytic effects through GABA receptor modulation. Not a pharmaceutical intervention, a real, gentle, evidence-supported neurological signal that the day is ending and the body is safe to rest. At 10 p.m., sleep environment preparation. Ensure your bedroom temperature is between 65 and 68 degrees Fahrenheit. Temperature-controlled sleep significantly reduces the frequency of the nighttime awakenings and partial arousals during which arrhythmias most commonly initiate. Keep a full glass of water on your bedside table. Make a thorough bathroom visit before bed to minimize nighttime wakings that disrupt cardiovascular recovery. If you snore, or if you have been told you stop breathing during sleep, sleep on your side rather than your back. Side positioning reduces apneic frequency and severity, regardless of the other variables in play. And in combination with the removal of evening alcohol's muscle relaxant airway effect, the improvement in airway patency can be immediate and dramatic. A conversation you need to have. I want to be honest with you about something before we close. If you are drinking every evening, and you have been drinking every evening for years, and you are over 50, please do not simply stop abruptly without speaking to your physician. In individuals with physical alcohol dependence, a state that can exist even at moderate consumption levels over extended years, abrupt cessation carries its own cardiovascular risks, including withdrawal-related hypertension and arrhythmia. Your physician can guide you through a safe, structured reduction plan that protects you during the transition. This conversation may feel uncomfortable to initiate. Many of my patients have delayed it for exactly that reason. But I need you to understand something. Your physician has this conversation regularly. They are not there to judge the evening habit you have maintained for years. They are there to help you change it without creating new risks in the process. That conversation is not a failure. It is the most protective thing you can do with a single phone call. Please also speak with your physician if you experience any of the following: heart palpitations or irregular heartbeat sensations that occur at night or upon waking, morning headaches that are new or worsening, difficulty catching your breath during sleep, waking with an unusually rapid or forceful heartbeat. These are not abstract concerns. In the context of everything we have discussed tonight, they are signals that deserve same-week medical attention. What you now know, and what to do with it. A man I knew died in his sleep from a habit he had maintained for 19 years without incident. He was not reckless. He was not uninformed in a general sense. He simply did not know what I have shared with you tonight. And nobody who loved him knew it either. You know it now. Evening alcohol consumption in adults over 50 with any degree of cardiovascular vulnerability creates three compounding mechanisms of overnight danger. It produces a sympathetic rebound surge that drives blood pressure and arrhythmia risk during deep sleep. It directly destabilizes the heart's electrical conduction system, making dangerous rhythm disturbances dramatically more likely. And it thickens the blood through diuresis, extending the overnight stroke risk into the vulnerable early morning hours. It compounds with blood pressure medications, undermining their nighttime protection. It worsens sleep apnea, stacking airway-driven cardiovascular stress on top of its own. It triggers vagal arrhythmia pathways through acid reflux in the supine sleeping position. And all of it happens while you are unconscious, while you feel nothing, while the room is quiet and the night looks peaceful. The change is available to you. The protocol exists. The evidence is clear and the benefit is rapid. A 52% reduction in major cardiovascular events from a single behavioral modification, measurable within months of making the change. The man I told you about had a wife who reached over one morning, expecting warmth, and found cold instead. He had children who got a phone call they had not prepared for. He had plans for a decade that never arrived. He would have wanted you to watch this video. He would have wanted you to share it with every person over 50 in your life who pours an evening drink without knowing what it is quietly doing to the heart that has never once let them down. Please, make the change. Have the conversation. Share this with someone who needs to hear it. I am Dr. Julian Cross. Your heart has been faithful to you across every decade of your life. Tonight, be faithful to it in return.